I would like to talk on multiple myeloma. Multiple myeloma is a disease of the blood, especially occurring in plasma cells. Plasma cells are cells which produces antibodies for fighting the diseases or infections. If a plasma cell goes rogue or they do not function like a normal plasma cell and start proliferating endlessly, that is when we get plasma cell disorders, and a manifestation of that is multiple myeloma. Mainly multiple myeloma occurs inside bone marrow, so the primary symptom is backache or bone pains. But also because of lower immunity, there could be secondary infections, and bone marrow involvement also tends to produce anemia. The way to diagnose this particular disease is to do a blood test known as serum protein electrophoresis, on which we get an abnormal band which we call as M band. These bands represents the abnormal proteins produced by those single type of rogue plasma cells. After we have got an M band, we look into the bone marrow of the patient to see how much of the bone marrow is involved with plasma cells. Also, we look at bones where we can see small lytic lesions which are generally very prominent in the skulls and other flat bones. Having diagnosed a myeloma is not end of the world. It's a very slowly growing disease generally, not all the time, and we start treating with something called a chemoimmunotherapy. These are drugs which helps in fighting the disease. The chemoimmunotherapy consists of injections, tablets, and steroids. This treatment goes on for at least 6 months for initial control of the disease. After the initial control of the disease, if a person is young, then he or she is referred for autologous hematopoietic stem cell transplantation. Having said that, it is the diseases of the old age, so a large number of patients will be ineligible for hematopoietic stem cell transplants, and they will be treated by drugs endlessly till the remission or till the drug is acting. A problem with multiple myeloma is a very small percentage of these patients will be cured, but largely it is like diabetes or hypertension, where the disease is controlled, but the drug continues endlessly for their lifetime. The problem with multiple myeloma is the bones become very fragile, so there has to be a lifestyle changes with multiple myeloma, where the bones have to be preserved, especially in the elderly, where falls are very common, and fractures would be rather difficult to treat in this situation. Myeloma also involves an abnormal protein which clogs the filtering path of the kidneys and causes renal dysfunctions. So we can also get a chronic kidney disease with myeloma. And as a consequence of the chronic kidney disease, there could be less secretion of erythropoietin from the kidneys, and consequently the hemoglobin is low. The RBC production is low and the hemoglobin is low. These are generally the main problems with myeloma. Again, myeloma can sometimes affect the nerves, both as a disease part or as a adverse effect of therapy. This creates something called pins and needles in the periphery, and in the medical way it is known as peripheral neuropathy. The treatment here is to treat the myeloma and support the patient for neuropathy with other necessary drugs. Thank you.